Hello ladies and gentlemen, welcome to my YouTube channel. My name is Bernard Odawa, and the purpose of this channel is to educate you on different medical conditions, what causes them, how they present in our body, and also how to prevent them, and also the complications which may arise from this condition. So please stay tuned and remember to subscribe to this YouTube channel, hit a notification bell so that you can be notified whenever I uploaded a new video. And today we are going to discuss about a very common medical condition called gastritis. And gastritis is a very common condition which has affected so many people, and many people are suffering from it without knowing what causes it and also how to prevent it. So kindly I ask you to watch this video until the end of it so that you can able to educate each other and learn how we can get rid of this condition. So to start with definition, gastritis is the inflammation or irritation or erosion of the lining of our stomach. This can occur suddenly or gradually. And there are several causes of gastritis, of which we are going to discuss about them. And number one in our list is excessive alcohol intake. When you take excessive alcohol, it tends to irritate the lining of the stomach, which will lead to inflammation and later on develop into gastritis. The second one is excessive stress. When you stress yourself so much, there is a reduction of blood flow to the gastrointestinal tract, and this will lead to the inflammation of the tissue along the lining of the stomach, leading to gastritis. Number three is bacterial infection such as Helicobacter. These bacteria are found along our stomach, and these bacteria may irritate the lining of our stomach, leading to inflammation, later on developing into gastritis. Number four is medication such as brufen, diclofenac, or aspirin. This medication inhibit production of a very essential enzyme called prostaglandin. This prostaglandin normally help to cover the lining of our stomach. So whenever there is inhibition of this enzyme, the lining of the stomach will be exposed to weak hydrochloric acid, leading to the inflammation and later on forming gastritis. Number five is bile reflux. Bile juice is a very essential digestive fluid which is being produced by our liver. So this fluid flows from the liver to the gallbladder through a bile tract. So whenever there is a backflow of this juice back to the stomach, this juice will irritate the lining of the stomach, which later inflame, forming gastritis. Number six is taking hot food. By taking hot food, there is corrosion and inflammation of the lining of the stomach, leading to gastritis. Do spicy food, that's another cause. Spicy food may lead to gastritis, because I know most of people like taking food with excess spice so that they can get the taste of this food. And this one is very harmful to our health, because spices will lead to excessive production of weak hydrochloric acid in our stomach, and this one will irritate the lining of our stomach, leading to inflammation and later on developing into gastritis. So those are some of the causes which I've tried to discuss with you, and we are going to see how this condition presents in our body. Number one is nausea and recurrent abdominal upset. Nausea, this is a feeling that you feel like vomiting, but you don't vomit, and this one occurs mostly whenever you feel the smell of food or you feel like eating food. Another signs of gastritis is abdominal bloating. Abdominal bloating, this is a feeling sensation of the fullness of your abdomen. Sometimes you just feel that your stomach is full even if you have not taken anything. And the third signs and symptoms of gastritis is the burning sensation on the upper part of the abdomen. This normally occurs between the meals or later in the night. Another sign of gastritis is vomiting. Vomiting, this normally occurs immediately after eating food. Whenever the food has reached your stomach, you just feel like vomiting it immediately, and at times it is followed by coffee-like substances, vomiters. Another signs and symptom of gastritis is general body malaise. General body malaise means you feel weakness on your body, and mostly it is associated by dizziness and also slight headache. Another sign of gastritis is loss of appetite. This normally occurs whenever you see or you have a smell of food. You just feel that you don't feel like eating this food. Yes, those are some few signs and symptoms of gastritis which we normally experience, and I'm going to discuss with you on how we can prevent this condition from affecting us. And we are going to list some ways of how we can prevent these conditions, and the first one is alcoholism. So if you are alcoholic, you have to stop or reduce the amount of alcohol you drink, because as we have already discussed, excessive alcohol intake may lead to gastritis. The second way we can prevent gastritis is by avoiding excessive stress. So I know this one is not easy, but at times it is good to avoid stress so that you can prevent development of this condition in our health. Another way of preventing this condition is by seeking a medical advice, or whenever you feel these signs and symptoms, you may go to a doctor, whereby a doctor will prescribe some antibiotics so that in case you have this Helicobacter in your stomach, this antibiotic will cure this bacteria, hence preventing you from developing gastritis. Another way you can prevent gastritis is by taking antacids. Or there are some medication which are being referred as proton pump inhibitors. Example of this drug, we have omeprazole. These are drugs which prevent our parietal cells, which are cells in our stomach, to produce more acid. So whenever you take this medication, it will cut off production of excessive acid in our stomach, which will lead to gastritis. Yeah, another way of preventing gastritis is just to avoid this spicy food. Of course, we can take food without even putting this spice in order to improve our health. Yeah. Another cause of this gastritis, another way of preventing this gastritis is to avoid taking hot food. You can just leave your food to cool up, then you take it. Or if you don't want to take cold food, you can just leave it, or you can just warm it and then you eat it instead of eating a very hot food. This one will help you to avoid developing this disease called gastritis. So from there, we are going to see or to discuss on some of the complications which may arise from this condition. And number one in our list is bleeding. How does gastritis lead to bleeding? Excessive corrosion or irritation along the lining of our stomach will lead to ulceration. This repeated ulceration may lead to bleeding of small capillaries along our stomach. and this bleeding may lead to excessive loss of blood, which later causes anemia in our body. The second complication which may arise from this gastritis is peptic ulcer disease. Peptic ulcer disease, it's a disease which may arise from gastritis because as initially we have discussed that bacteria such as Helicobacter can cause this gastritis. So whenever there is ulceration along the line of the stomach, this bacteria will start feeding on the walls of our lining, hence causing ulceration, which is known as peptic ulcer disease. Another complication which may arise from this one is gastric outlet obstruction. Gastric outlet obstruction may arise as a result of inflammation or edema which form along the intestinal tract. So this inflammation along the intestinal tract may inhibit or prevent the flow of food from the upper part of the stomach into the small intestine, or from the stomach into the small intestine. So this reduction in movement may lead to obstruction of food from passing from stomach into the small intestine. Another complication which may arise from gastritis is dehydration. How does gastritis lead to dehydration? As we have already discussed earlier, one signs and symptom of gastritis is vomiting. So by excessive vomiting may lead to reduction of fluid or water in our body, and also it may lead to loss of very essential electrolytes in our body. This one will lead to dehydration. Another complication which may arise from gastritis is renal insufficiency. Through excessive vomiting and loss of these essential electrolytes, there will be a reduction in the blood flow to our kidney, which will lead to insufficient blood flowing into our kidney. Hence, this will lead to reduction of kidney function, or what we call glomerular infiltration rate. Yes, glomerular infiltration rate. This is a rate at which the kidney eliminate harmful substances from our body. So you see, through this gastritis, which results to excessive vomiting, there is a reduction in blood supply to the kidney, which will hence reduce the glomerular infiltration rate, which will also affect our kidney. Yeah, I think that's all about the complications which may arise, and I think that brings us to the end of this studies, or the end of this video. And kindly I ask you, if you are a medical student, if you are a medical student, or you are a medic in any other sector, I kindly ask you to subscribe to this video or to this channel, so that we can able to educate each other and also help to improve the health of our client. Thank you for watching, and may God bless you.